Well, I did talk about the Reform UK Emergency Health and Social Care Recovery Plan and the challenge for the party to continue to build support, broaden out its policy offering and try to, of course, keep the momentum in the polls and try to overtake the Liberal Democrats and become the third party. Now, I'm going to show you some of that launch from Richard Tice on this very subject. Tice talking about targeting 0 waiting lists and saying it is achievable within 2 years and declaring we're in a national health emergency. So watch this from Tice that you may not have seen elsewhere, and let me know in the comments below, do you agree with the Reform stance on this, and are you currently intending to vote Reform at the next election or not?
There are multiple crises all over social care and healthcare. And we hear from everyone that there's a staffing crisis, and there clearly is, in both departments. Hard to know exactly how much, but it's, give or take, it's 200,000 plus shortfall across both health and social care. Ambulance crisis with record long waits. We've got strikes literally happening in front of our eyes. Unknown to us. Nurses going on strike. Confidence amongst frontline workers at record lows. Confidence amongst the population at record lows. David touched on this issue of the excess deaths. What is going on that some 500 a week excess deaths above the 5-year average is happening? And yet, no one's talking about it. Where's the Health Secretary talking about it? Where's the Chief Exec of the NHS explaining about it? If you go back to COVID years, every day there was a press conference because people were worried about excess deaths. Could it be that there is a culture of cover-up which is endemic in the NHS? We know there is a major crisis, and yet there are no bold solutions whatsoever coming from the mainstream parties. The truth is, the blunt truth that they won't tell us, is that we now have a national health emergency. It is, sadly, as bad as that. Right, we'll have a big proposal. All frontline, patient-facing healthcare staff and social care staff would pay for 3 years 0, I repeat 0, basic rate income tax. And that this would apply across the NHS, across the private healthcare sector, across the social care sector. It would not apply to agency staff. We need dedicated, loyal staff back in the NHS, back in private healthcare, not, in a sense, on a temporary basis within the agency staff community. And this proposal should apply to UK staff only, so people currently living in the UK. The top rate of tax would still apply to those earning above the top rate threshold, just over £50,000, but also those staff would also benefit from a 0 basic rate income tax ban. So that will be good for GPs and consultants and surgeons who also are leaving the trade because they feel sometimes it's just not worth it. We believe that this bold, imaginative proposal would benefit some 2 million frontline, patient-facing staff in the NHS and social care. The other key thing is that we've got to buy more private healthcare use, operations, capacity by the NHS within the private healthcare system. And indeed, as was done 20 years ago by the Labour Party, when they got waiting lists down to very low levels, overseas if required. But I think the NHS is going to need to buy in the order of 3 million operations. £3 a pop, that's 9 billion. The sums are big, but I'm going to tell you how we fund it. So the total cost to get to 0 waiting lists after about 2 years, it's around about 15 billion a year for 2 years. But we have to do this. We have to be bold. We have to target something that's really challenging, that people treat as a national endeavour. 0 waiting lists in 2 years. to bring us in line with what people expect and demand and get in other Western nations. I'll give you an example of how extraordinary it is. I was in Australia recently, giving a speech to a bunch of sort of political folk, and I talked about the government's pride in announcing a target of 14 days to see a doctor. They laughed at me. They thought I was joking. 14 days, they said. In Australia, if you couldn't see a doctor in a day, there'd be riots on the street. That's how low our expectations have gone. It is simply not good enough. We have a national health emergency. We have to be demanding, but to get to zero waiting lists, we have to be bold. We have to think big. We have to think about a national endeavour. And we have to go for it. Imagine that I'm the Governor of the Bank of England. I pick out of my pocket a £20 note. In fact, actually, I go to my home printer and I print a £20 note and another one and another one. And I give every £20 note to each of you in this room. The truth is, it's not your money. I printed it. I'm the Governor of the Bank of England. So if I've given you that £20 note in order to add to the money circulating, why would I then, having given you that £20 note, why would I pay you interest on the money that I've just given you? If you had a £20 note and you gave it to me to look after for you, as the sort of most secure place to keep it, then sure, it's your money. You'd ask me to pay you some interest. But if I've printed it on the home computer and just given it to you to help the economy, why on earth would you demand interest from it? Why would I give you money and then pay you interest on the money that I've just given you? That, ladies and gentlemen, is the nub of what is going on at the moment with all of what's called the Bank of England's quantitative easing. So here's how we fund this solution. Currently, the QE debt, the quantitative easing debt, is around about 850 billion quid. I mean, these numbers are just off the scale. It's impossible to imagine. But what we've got to do is we've got to redesignate all of that QE debt that sits on the Bank of England's computer. Remember, they literally just printed it on their computer and sent it around. Redesignate it into 75-year warlike corona bonds. Fix a nominal rate of interest on it of 2%, and then you tell the whole market and you tell everybody it's staying on the computer for 75 years. It'll deflate away into nothing. We'll all be long gone. You confirm to markets that you're not going to try and sell any of this debt back into the markets.